Using an anti-shock garment. An anti-shock garment is a stretchy wrap designed to stabilize a woman in shock from postpartum hemorrhage. The garment applies pressure to a woman's lower body and abdomen, which forces blood to her heart, lungs, and brain, keeping her alive. She can receive treatments, be transported, and survive delays in receiving blood and surgery. This device adds time to seek treatment, and this can save a woman's life. This video will show how to put the garment on and how to remove it safely. The garment has 3 leg segments, a pelvic segment, and segments 5 and 6 that go around the abdomen. Segment 5 contains a foam ball that is placed over the umbilicus, adding extra pressure. The segments are attached securely with fastener strips. Explain to the woman why the anti-shock garment is needed and how you will put it on her. If she is too weak and dizzy or not conscious, have a helper assist you to put the garment under her. Here's how. Place the garment next to the woman. Open the top part. Roll up the ends of segments 4 and 6. Then fold the top half along the dotted line. Roll the woman on her side. Place the top segment at the level of her lowest rib, with the dotted line along her spine. Roll her on her back, and then towards you. Flatten the garment. Then roll her onto her back. Open the rest of the segments. Then check that the pressure ball is at the level of her umbilicus. Now, begin at her ankles and close each segment pair in order of the numbers. Notice that the first segment hangs below this woman's feet. To make the garment fit her, fold the first segments into the second segment. Now, start closing the leg segments as tightly as you can. To ensure a proper fit, pull up on the fabric with a finger and let go. A snapping sound tells you it's tight enough. Tighten it more if you do not hear the snap. Try to leave her knees free so she can bend them. Now, apply the abdominal segments. Only one person should apply segments 4, 5, and 6 so they are not too tight. Ask the woman to take a deep breath. If she can, the garment fits correctly. You can reach under the segment to check her uterine tone and massage her uterus. The garment is also left in place for vaginal procedures. Transfer the woman with the garment in place. Be careful not to open the garment too soon, or the woman can go into shock. Once the woman has been stable for at least 2 hours, start to gradually remove the garment. Stable means normal postpartum bleeding, a pulse less than 100, and a systolic blood pressure more than 100. This woman is now stable. Her bleeding is minimal. Her pulse is 80, and her blood pressure is 110/70. Keep her IV drip going and be ready to give fluids rapidly if she does not remain stable. Start by opening only the ankle segments. Wait 15 minutes. Then check her pulse. It's still 80. Her blood pressure is 112/70. The numbers are nearly the same as the last numbers. She is stable. Now, open both of the next segments. Wait 15 minutes. Now check the woman's pulse. It's gone up to 104. Her pulse is now over 100, and her blood pressure has dropped to 90/60. The top number is now less than 100. She is not stable. Be aware that the difference in her numbers is also important. Follow the rule of 20. If at any time the pulse rises more than 20 points, or the systolic blood pressure drops more than 20 points, she is in danger. Quickly close the garment again, starting with the last segment opened, and continue from top to bottom. Then look for the source of bleeding and increase her IV fluids. When the woman is stable again, continue opening each segment pair in order of the numbers, taking her blood pressure and pulse and waiting 15 minutes between each one. At each point, the woman's blood pressure has not dropped more than 20 points, and her pulse has not increased more than 20 beats per minute. She has remained stable. It is now safe to take the abdominal segment off. Fold the garment after it's been cleaned, disinfected, and dried. Here's how. Remember, the anti-shock garment forces blood to a woman's heart, lungs, and brain, keeping her alive. Put the garment on beginning at her ankles, closing each segment pair in order of the numbers. Once the woman is stable, gradually take the garment off, starting at the ankle segments.